Recently, the Chinese Ministry of Commerce stated that Beijing, Tianjin, Shanghai, and a few other provinces will take part in a pilot test to set up wholly foreign-funded hospitals. The program that was launched in July is set as a part of reforms to improve Chinese medical services. They also hope to introduce more competition in the tightly regulated health sector, while upgrading the export and investment-reliant economy. Currently, there are over 11,000 private hospitals in China. This is a massive rise from the just 3,200 in 2005. But they are all established under old policies. These policies only allow foreign investors to own a maximum of 70% of the hospital in joint ventures. The restrictions began loosening last year. In September 2013, Shanghai's free trade zone received government approval to set up wholly owned general hospitals, specialty hospitals, and outpatient units. In January of this year, Hong Kong, Macau, and Taiwan have been allowed in the prefecture-level cities nationwide to set up wholly owned hospitals. A Deutsche Bank report from June shows a further 8,000 public hospitals were likely to be privatized over the next 5 to 10 years. New analysis is suggesting healthcare spending in China is set to hit the $1 trillion mark by 2020. Xinhua News Agency's reports many Chinese people have high expectations for foreign-funded hospitals. They are looking forward to enjoying a higher level of health care, more advanced medical equipment, and friendlier service attitudes in these up-and-coming foreign hospitals. The current Chinese healthcare environment is far from satisfactory. Chinese hospitals suffer from shortages of funding, and there is a steep gap between urban and rural care. This often leads to high rates of bribery and increased tensions between patients and doctors. The difficulty and expenses for medical services is a problem that has long plagued Chinese society. Widespread wealth gaps have made it even harder for China's poor to get access to health care. This is despite Beijing ordering hospitals not to turn away patients who need emergency treatment. It is a common scene to see people sleeping outside on the ground in front of Beijing's big hospitals, sometimes even for days. And this is just in order to register to see an expert doctor. Most of these people come from less developed areas where the healthcare services can't cure their diseases.